The CPS Career, Internet of Wearable E-Textiles for Telemedicine, referred to by its project name Kaya, is being worked on by the Wearable Biosensing Lab at the University of Rhode Island. Kaya, as a study, focuses on Parkinson's disease, its interventions, and existing wearable technologies for movement disorders. When medication like L-DOPA treatment is ineffective, the patients are treated with DBS to alleviate the severe movement symptoms on a 24-hour basis. At this point, an assessment is required to quantify the intensity of the symptoms. Neurologists with specialized training perform Unified PD Rating Scale, UPDRS, a standard clinical assessment consisting of movement exercises. UPDRS is used to optimize deep brain stimulation, also referred to as DBS, for each patient. However, with this, a major yet common challenge emerges. With an infinite amount of DBS parameter combinations, neurologists must optimize through iterative testing of individual combinations. This requires repeated clinic visits for patients over several weeks to months. The approach taken to overcome this challenge is to provide the neurologist with a patient record with an effective interpretation of how the patient has been performing the UPDRS exercises at home. Here, the patient is provided with assistive technology that reminds, analyzes, and scores them on their daily UPDRS movement exercises. The overall architecture uses Bluetooth for personal areas between the glove and the user, while the fog and the cloud utilize MQTT for wide area networks. MQTT is chosen with the design decision that reliance on large datasets being streamed up and down causes unreliability, and instead analytics should be computed near the user.
My name is Andrea Hopkins. I'm 71 years old, and 15 years ago I was diagnosed with Parkinson's disease.
Parkinson's disease patients like Andrea commonly perform UPDRS motor tasks like finger tapping to monitor their tremors when visiting their doctor. These tasks are also encouraged to be done at home. However, without proper feedback, the effectiveness of these exercises varies. This is why we've developed the Smart Glove. By incorporating flex sensors into the fingers of the glove, we can monitor the wearer's fine motor skills through a variety of tasks. This glove communicates to an Android phone to provide feedback to the patient. It uses Bluetooth Low Energy, it's motion sensitive, and it's rechargeable, with only a single on and off switch. We also supply insoles that are pressure sensitive at the toes and heels. The dongle is the same as the Smart Glove and is interchangeable across wearables for the convenience of the user. After attaching the dongle to the insole is placed inside the shoe and the dongle rests on the outside. This allows us to monitor more motor tasks that involve the feet, such as heel taps and toe taps. After the wearables are ready to be used, the patient would then begin their guided exercises by using their Android smartphone. They can select up to 8 different exercises that use either the gloves or the shoes, including finger tap, closed grip, hand flip, screen tap, heel tap, toe tap, foot stomp, and walk steps. When the patient starts a new exercise, the application identifies which device it needs to connect to. After the connection is complete, and the patient is ready, they can begin their exercise. They'll be guided with on-screen visuals that inform them of their progress. Patients can create an exercise routine by adding multiple exercises in a playlist that can be completed in succession. Here, the application identifies the shoe and begins the connection. The data from the wearables is collected throughout the entirety of every exercise, so it can be sent to a database for long-term analysis. This process is repeated until the patient finishes their daily exercise routine. The daily information gathered by the wearables can be accessed by the patient and their doctor, allowing them to make a better informed decision about their treatment plan.
There's no cure for Parkinson's, but medications do address the symptoms. And that's why sensors give the doctor critical information that helps to know whether or not the medications are working.